An active lifestyle demands healthy legs, but vein disorders can really slow you down. And Dr. Robert Cutchen, founder and director of the Albuquerque Vein and Laser Institute, is back here on New Mexico Style to tell us how we can learn to love our legs again. So tell us again before we do it. Well, first of all, welcome.
Thank you. It's good to be here again.
And I want to ask you first, before we go into anything else, remind our viewers, what is a varicose vein?
Okay, we've talked about this before, but
Yes.
I feel like it's important to always talk about it because it can be really confusing to people.
It can.
Well, the first thing is just to remember that the job of our veins is to take the blood back to our heart so our heart can pump it all over again.
Yes.
And when we're talking about our legs, the blood should only flow up and out of our legs back towards our heart. Well, gravity is always pulling our blood down.
Always.
So inside of our veins, we have these little valves, and they're just little one-way doors, and they open so the blood can flow up towards our heart. And then gravity is always going to slow it down and pull it back for just a second. And when that happens, the valves snap closed.
Okay.
And the next image shows that these valves snap shut, and that prevents the blood from flowing backwards towards our feet. Unfortunately, in a varicose vein, the valves are broken, and that occurs either because the veins become dilated or sometimes the valve will just give out.
Wow.
And the result is that gravity wins and the blood flows backwards down that vein towards your feet.
Okay.
Well, that backs everything up, puts a lot of back pressure in the vein, can cause some veins to bulge out, and that's what causes the discomfort in your legs, which is this kind of heavy, achy,
Right.
tired feeling.
So that's really how it all comes about. But what are the symptoms that we should look for personally?
For most people, their symptoms are going to occur when they're on their feet.
Okay.
Some people feel them when they're sitting a lot, and it's mostly just a feeling of your legs being heavy, kind of tired. Some people will feel throbbing, burning. When I had my varicose veins, before I had them treated, I had a lot of itching in my legs. And so it can be just kind of a variety of things, but just kind of a general discomfort, heavy, achy feeling.
Okay, so that will explain why a lot of people might be feeling those things, and they're wondering, why am I feeling this?
Right.
So that's a good reason to go and check it out. And one of the things that a lot of people talk about is restless legs, okay? So how do restless legs and varicose veins kind of interact with each other?
They can be related, and restless legs is pretty common. It occurs in 5 to 15% of the population.
Okay.
And in a lot of cases, we don't know what causes it. We just kind of aren't able to figure it out. But there are other medical conditions that can contribute to restless legs.
Okay.
And those are conditions like diabetes and kidney problems and iron deficiency, and varicose veins are one of those.
Okay.
And the symptoms of restless legs, it's kind of just a discomfort in your legs. Your legs just feel kind of irritated at rest, and as soon as you move, your legs feel better. So people are always... Is it kind of like when your foot falls asleep and you just feel like you have to move it? It's probably a little bit of that feeling. It's kind of some people do describe a tingling, but it's kind of a discomfort that just as soon as you move, you feel better. Okay. So people's legs just feel real anxious, and they're always feeling very restless. Sure. And they can be associated with varicose veins. And so what I tell people is that if they come in and tell me they have restlessness, is that not everybody with varicose veins has restless legs, and not everybody with restless legs has varicose veins, but they can be related. Okay. Well, then how can a person be evaluated to know if their restless legs are actually being caused by the varicose veins? So someone should be suspicious if they have any bulging veins on their legs or any of those other symptoms when they're standing, that heavy, achy, tired feeling. Okay. And the way we really figure it out is to do an ultrasound. Oh, okay. And when we do the ultrasound of your legs, we have to do it with you standing up, and that's the way we're able to test your veins to see if they're... Because of the gravity? Exactly, to test your veins if they're carrying the blood up like they're supposed to, or if the blood's flowing backwards. And so if a person does have some varicose veins that we find on the ultrasound, and if they have those restless leg symptoms, then they're a good candidate for treatment who will hopefully get some relief from that restlessness. Okay, and this evaluation, of course, with the ultrasound is a painless evaluation. That's the beauty of the ultrasound. So there's nothing to be afraid of. No needles, no pokes. It's just, we just take a look at it and use a nice warm gel to keep your leg warm there. Exactly. Well, let's talk a little bit about pelvic varicose veins and how that comes about. And what are those symptoms? And pelvic varicose veins are another aspect of vein disease, and this is very much more specific to women. It occurs in 4 or 5% of women. Really? And these are varicose veins that are going to be on, that are pelvic and often on the vulva or on the labia of the vagina. Okay. And they're related to pregnancy, and every pregnancy is going to make them worse. And a lot of women notice some bulging veins during their pregnancy, and there's so much more pelvic blood flow during a pregnancy. As the uterus gets bigger and bigger, there's more pressure on the large veins of the pelvis. Okay. And all that pressure can cause these veins to essentially get bigger and bigger.
Sure.
and can cause a lot of symptoms.
Okay.
And the symptoms of vulvar varicose veins or pelvic varicose veins is that same kind of heaviness or aching in the pelvic area.
Okay.
Some people will notice even some swelling. Some women will have discomfort with intercourse, and some women will have very uncomfortable menstrual cycles.
Wow.
And so if they're having those symptoms, and especially if they can see any bulging veins in that area,
yes,
we should be suspicious that that may be causing some of their symptoms.
I think it's great that you're addressing this, because there's probably a lot of pregnant women out there maybe going through this and they don't know what's going on or what's wrong, and if they're somebody that's alone in this or if other people are dealing with the same thing. So it's really wonderful to address that and be able to find a way to find out if that's really what the problem is.
Yeah.
So now if they come into you and they want to be evaluated for pelvic varicose veins, how do they do that?
Well, once again, the beauty of ultrasound, and it's a nice painless procedure, and we can essentially just look with the ultrasound machine and see if we're seeing any varicose veins in the vulva or the labia of the vagina.
Okay.
And if we are, depending on how many we see, if we're seeing a whole lot, a patient may need a little bit further evaluation, and sometimes we'll send them for some other studies and further evaluate them, but really we can get an initial idea just by doing an ultrasound and seeing what we see.
And it's, like we said, a painless, it's a painless evaluation. And there's going to be a free vein screening event on September 15th. Tell us real quickly about that.
Patients come in and they're welcome to come in for a free screening. It's about a 10-minute long appointment, and they get a chance to meet me, and we talk a little bit about their medical history and some of the symptoms that they're feeling in their legs. I take a look at their legs and try and decide if we're looking at more of a medical problem or more of a cosmetic problem.
Very good point.
And I can make some recommendations if they need further evaluation or not. Fabulous.
And of course, information to be able to reach you is coming up on our screen right now. You can call 505-848-VEIN, and they are located at 7401 Hancock Court, Northeast in Suite A in Albuquerque. Thank you so much, Dr. Cutchen. We appreciate you being here.
Thank you so much.
Really helpful information, and hopefully everybody will head out for those free screenings. September 15th. That's great. Now, still ahead, how can an outdated city ordinance be costing you big money? Find out after the break.